TCAT Oneida-Huntsville will launch its brand new Allied Health and Medical Assisting program in September 2025 by welcoming aboard veteran instructor Sue Sims.
That new Allied Health program will consist of beginning with CNA, and it does like 126 hours, and then it will go into phlebotomy, then it'll have anatomy and physiology, and then medical terminology, and EKG, and also then you'll have some more medical. It'll teach them how to be a medical assistant. And also, if they pass their anatomy and physiology, that will serve as credits towards, like at Rome State, if they decided to go into the RN program there. So that's a win-win. The end of each segment, like the end of the CNA hours, they can get a certificate and quit if they'd like. At the end of the phlebotomy, their hours, if they pass, they can get a certificate and pass and quit. And at the end of the EKG portion, they can stop and get a certificate, or complete the whole program and get all the hours and receive a certificate. So, it's up to them. For those of them that's had hours and already have their CNA, already have their phlebotomy, they can jump into the program in the latter stages and receive a medical assistant certificate. And it's good for people that don't have the time to stop working completely and have to support their families. And so I really love short-term programs that help people to support their families and make better money. Several of my students that have finished the CNA program and then taken the phlebotomy have went to hospitals and gotten jobs there, but they would already be ready to go to work in doctor's offices, hospitals, labs. The opportunities are endless. I just like to see the lights light up in their eyes when they get it. And watching them interact with the patients, I love that. And within, say, like 2 or 3 days, I see the ones that's gonna stay, that's gonna work, it's gonna click. I always wanted to be a nurse. Since I was a little girl, I just always thought that was my calling. I got married young, I had babies young, I dropped out of high school. You didn't go to high school when you were going to have a baby. So I went back to school after that and got my GED. Then I went to LPN school, and then while working 2 jobs, raising babies, I got my RN degree, and then I worked lots of different jobs. I did private duty. I did a lot of times on the weekends, and I would work at the hospital. I worked home health. I worked surgery. I worked oncology. I did a lot of different jobs. I just love taking care of people. I gotta make these people ready to take care of me.